the heart of Kayole Estate, along the busy Tushariane Corner Road, sits St. Patrick's Healthcare Center. This center was opened in 2001 as a small medical practice. 17 years later, the hospital is now offering services from outpatient and inpatient services, maternity, dental, optical, theater, and laboratory services. In 2008, St. Patrick's joined the Tunza Family Healthcare Network and became part of the Health Social franchise. Anne Maina, the founder of this center, has seen a remarkable change since joining the franchise.
When I joined Tunza, I'm happy because I can measure where did I come from, where have am I today in knowledge, skills, and even in business-wise.
By virtue of being a member of Tunza, Anne realized that running a hospital can be a lucrative business. St. Patrick has not only turned out to be a good business, but Tunza also helped in capacity building.
We signed an MOU whereby we are going to work together. They will support me in various ways, like continuous education, like materially, if we want to hold a medical camp, they are there for me.
Providing quality services is a mandatory requirement for Tunza and St. Patrick's, and continues to provide care for at least 80 patients in a day.
When St. Patrick came, mothers are not delivering in their homes, whereby there are a lot of risks that are, right with the delivering at home. They are not walking long distances. They used to go to Kenyatta. That is before even Mama Lucy was there. There's also a lot of congestion in Mama Lucy and even the city council facilities.
As the push for universal healthcare continues, the government has earmarked affordable healthcare as one of the priority areas under the Big Four agenda.
Our main focus is on the small, medium private sector providers who offer services to the low-income Kenyans. So our job is to try and see how do you bring them up to a standard of being able to deliver quality services and affordable services to all Kenyans.
Joyce Wanderi, the CEO of PS Kenya, says that the public health sector has an upper hand in terms of investments as opposed to the private sector, and the social franchise model has been able to bridge the gap. The Tunza Family Health Network, which is owned by PS Kenya, has since inception in 2002 partnered with over 400 clinics across the country.
We have managed to standardize the level of quality that we give to the clients. So everywhere you go into a Tunza facility, you'll be able to tell that this is a quality service I'll get and it's affordable. So by doing that, you're also able to scale up, which is part of the being able to achieve universal health coverage. You need as many access points for services as you can.
Though each business is independently owned and managed, all franchisees share in the collaborative benefits of the organization through support and oversight.
There's a comprehensive training on quality aspects, on even how primary healthcare, on how to deliver services specifically, and also introducing external accreditation mechanisms.
Joyce reckons that to grow a business, it is important to have a business plan. For sustainability and growth, PS Kenya looks at linking providers to private health insurance schemes and NHIF.
We try and make sure our providers are also empaneled on the NHIF platform. And the reason why we do that is because a lot of the people who go into a social franchise are poor or low income. And we want to reduce the whole aspect of paying out of pocket.
By reducing client reliance on out-of-pocket payments, as well as offering clinics a steady source of income, third-party payment systems have helped to overcome the tensions between serving low-income communities and the business needs of franchisees.
NHIF is very beneficial because clients are benefiting. When they come in, they pay nothing.
To date, 173 health providers have been empaneled to NHIF, representing 43% of the Tunza facilities. The target is to get 60% of Tunza facilities empaneled by 2019. Joyce also serves as chair of the Association of Social Franchises in Kenya, which includes Tunza, Amua by Marie Stopes, Gold Star, which deals with HIV and AIDS, and Kemet, which is based in Western Kenya, among others. The financial sustainability of these programs is essential to the success of social franchises in a changing donor climate.
I think the future of social franchising is from really moving beyond the current model we have to more aggregating all these providers into more formalized, more structured, more tight relationship with the franchisor than how we are doing it right now, because we are looking at a more sustainable model.